In today's episode, we're going to be talking about virtue ethics and how it relates to professionalism in healthcare. Virtue ethics is an ethical theory which emphasises the virtues or characteristics of the individual and was heavily influenced by the work of ancient Greek philosopher Aristotle. Virtue ethics is in contrast to consequentialist ethics, which claims that an action is right or wrong depending on the consequences of the action, and also in contrast to duty-based ethics, which claims that what is right or wrong is based on a set of universal rules or duties. So a virtue can be seen as an excellent trait of character or a disposition possessed by the moral agent which influences their mindset. For example, a person who is honest and has an honest character would not lie. This is not due to the consequences of lying, nor due to any rules. This is because they value and respect the virtue of being honest. A virtue such as honesty makes the possessor morally good. Therefore, the virtuous person is morally good and has the intentions to act in the morally right way. But there is a further condition of virtue ethics. For just by having good intentions, it does not always mean that we will carry out the right action. We also need to have what's known as practical wisdom, which is a concept introduced by Aristotle. If we think of virtue as putting the individual who possesses it in the morally right or morally correct disposition, practical wisdom helps them to know how to act on this intention in the morally right way. For example, someone with courage may have the intention to be brave, but due to not possessing this practical wisdom, may become reckless. However, that same individual may recognise this and learn from their experiences so that they fulfil their intention to be courageous. In this way, possessing a virtue, we habituate to carrying out the morally right action and being a morally good person. The advantages of virtue ethics is, firstly, it allows us to focus on the individual and their disposition, so we can see whether they have morally good intentions. And secondly, it allows us to modify the values based on the needs and views of society. So as we know, what society views as right or wrong and what is expected changes, and virtue ethics allows us to, in some ways, adapt to this. However, some of the disadvantages are that, firstly, it's not action guiding. For example, just having an honest disposition doesn't always tell us when we should tell the truth and when we should not in some situations. And secondly, there could be some debate over which values or virtues we should adopt. And again, this could vary from culture to culture and country to country. We can see virtue ethics in healthcare, and it features heavily when we consider professionalism. Traditionally, professionalism is defined as a set of virtues, values or behaviours which we as healthcare professionals must adopt. And we can see the earliest example of this being in the Hippocratic Oath. The characteristics which healthcare professionals generally are expected to embody include altruism, honesty, beneficence and non-maleficence, to name just a few. Not only do these virtues relate to our relationship with our patients, but they also apply to our colleagues and also to ourselves. The importance of these professional values are that they help us maintain the trust that the public has in the profession. And this is reflected in the Royal College of Physicians' definition of professionalism. This claims that professionalism is a set of values, behaviours and relationships that underpin the trust the public have in doctors. And we can see here that trust is the foundation of professionalism, and this can be seen as the basis of a social contract between healthcare professionals and the public. In return for looking after the health of our patients, we as healthcare professionals are given privileges such as special status and specific legislation and regulation relating to the profession. By upholding these values and virtues, we are able to maintain the relationship between the public and the profession. In summary, virtue ethics claims that to determine whether an individual is morally good, we should appeal to their characteristics. These will enable them to carry out morally good actions and be morally good people. We can see examples of this in healthcare. We're looking at professionalism, which is often defined as a set of values or behaviours which we as healthcare professionals must embody. To find out more about virtue ethics and for further information of healthcare ethics and law, visit our website healthcareethicsandlaw.co.uk and follow us on social media, which you can find the links to in the information below. Thanks for listening.